chronic sinus infections is a tough one to heal. Have you had to use lesser known treatments, and what kind of success have you had?
Of course, I've had to use lesser known treatments. Yes. So I use a lab called Microbiology DX. What we're looking for is lesser known infections as well. One of them is Marcons. It's a kind of staph infection, which is resistant to a lot of antibiotics. And it's common in people who have had Lyme disease, a tick-borne disease, I'll say, and mold illnesses. Now, a lot of the times, it's not easy to treat. A lot of the times it is. Now, if that Marcons is resistant to a lot of antibiotics, I'm going to know that's a strong case. It's going to be harder to treat if there's a lot of biofilm. It's going to be harder to treat. A lot of the times I'm seeing different funguses and different bacteria in addition, or instead of the Marcons, but often nowadays I'm seeing 2 or 3 different infections in the sinuses. And so I don't have time to go into the details of how, but I'm nebulizing different substances. Could be antifungal medications. It could be nebulizing antibiotics. Sometimes I'm using nasal probiotics. Sometimes I'm using some argent and silver. Actually, that's the Rolls Royce of silver. A lot of research has been done on this silver, and there's a specific method by which to do that. I wouldn't use just any silver. That's why you hear me hesitate a little bit. I want you to go try this at home. You need to have this under the guidance of a doctor who knows what they're doing with respect to this. So typically oral antibiotics are not going to do the trick for these chronic sinus infections.
Yeah. And many of these are considered by the conventional medical community as colonization rather than infection. But at the end of the day, they're talking to your immune system. And so we often will interchange them, but they still need to be dealt with. Again, but just remember, not everybody will have a great response. And that's why, as Dr. Parpia was saying, you have to look at other issues along with it, because again, it's not just because you have the colonization doesn't mean we treat it and you're all better. In some people, treatment doesn't do much of anything, and in other people, it's life-changing. So it's again, I wish we had simple answers. I think that's the thing that I'll say over and over again. If there were simple answers, we all wouldn't be here.